Improving maternal health begins way before pregnancy, which is why you need the right information to be able to plan a pregnancy ahead so that your body is settled and ready for the child you're about to bring. Studies show that 16 people die every day in Uganda. Those are pregnant women due to pregnancy-related complications. Also, 40% of pregnancies are unplanned, and 25% of these women go to antenatal care very late, which leads to sometimes miscarriages and several other difficult things surrounding pregnancy. And this is why today on NTV Medical Matters, we are going to talk about preconception as well as a little bit about conception so that you know what to do in case you're preparing to have a child. My name is Viola Kusasira, NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation. You're welcome. You're welcome to NTV Medical Matters once again. I'm Viola Kusasira. We are supported by Bill and Melinda Gates Foundation, and on this beautiful Monday morning, we are going to talk about preconception as well as conception. What does it entail? What creates the complications we always see mothers going through at the time of conception as well as birth, but also what happens before conception that could be the challenge affecting the pregnancy. So today we intend to break down what women and couples should know before conception and those first weeks of pregnancy, which are very critical. And we are joined by Othniel Musana, who's a consultant gynecologist at St. Francis Nsambia Hospital. You're welcome to the studio.
Thank you, Viola.
Yes, so first and foremost, preconception, what does it actually mean? Just breaking down the term, and then we shall talk about what it entails just before pregnancy.
So preconception means pre means before. Then conception, the act of actually the sperm and the egg coming together to form an embryo, or what we call a zygote in medicine. So preconception are the events that happen before you conceive. These events will start right from the time you are a fetus also yourself.
What?
Yes, so from the time you are a fetus yourself, those events that happen to you may affect how you will eventually conceive children and how the health of your pregnancies will eventually be at the end of your life.
Talk to us about that stage. It's way too early. How does someone, being a fetus themselves then affect how later on in life they'll have children?
So of course, you have two eggs coming together, your father and your mother all contribute half genetic material to come together to form one genetic set which is complete. Now, during your time as a fetus or as a baby inside your mother's womb, there are events that may affect the way you grow. And of course, part of those events will affect your reproductive system and how it is formed. For males, of course, we have the testis forming, the penis and other structures that will help you reproduce. For the females, you have other issues, like you have other events that lead to the development of the uterus and the ovaries and your fallopian tubes, all which are important in the process of conception. So if during the pregnancy in which you are conceived, there are certain factors, or maybe poisons, radiation, some abnormalities within the way you produce, the way your organs form, then of course later in life, later as an adult, when you come to the time to conceive yourself, then it becomes an issue for you. So now preconception no longer looked at just having sex with your partner to have a baby. We are now going back to what we call the life continuum, to see that right from your conception as a child, you like Musana, time I was conceived, all the events there are supportive of you eventually having a conception. Yeah.
Okay, so we were just having this discussion before we came on, and we're just looking at a few weeks before getting pregnant, and we're actually, most of us were actually looking at the woman and not thinking about the man at all, what he's doing, or right before, those just few weeks before pregnancy. But now that you take it back at birth, even before my own birth, so let's look at, you talked about organs forming. So at what stage do these organs form? up to the level where you say now they're proper and they're going to be functioning in the future for the next pregnancy. I've heard that females are born with all of their organs and all the eggs and everything, just ready to, you know, have children. What about the males?
So generally, let me put it this way. Males and females, the purpose we are born is to reproduce and expand the species so that we can survive. So reproduction becomes the most important function of a human species. We have to survive beyond our parents. Now, but also, half of your gene set is from your mother, half of it is from the father to form that complete set. Yeah. So each one of them has a very important role. But also, you notice that it's now factual that in cases of infertility or couples not being able to conceive, half of the problems are because there is a problem with the female, and half of the problems are caused because of the male. Though in Uganda, of course, because of our culture, men, we think we are always okay. But most times you'll find half the problems are for the man, half the problems are for the woman. So when you conceive, you don't conceive a baby. It is two cells coming together to form one cell. Now, that one cell then has a program, has a blueprint that will tell certain parts of the cell. Now you form the arms, you form the ovary, you form the testis if you're male and things like that. Now that process begins right from the time you conceive to about 9 weeks of pregnancy. 9 weeks of pregnancy. So that first 9 weeks, 9 to 12 weeks of pregnancy is very, very essential to ensuring that the future will be a good one. Oh. So if something interrupts that process, it may be a drug, it may be something in your food, it may be people who work in chemicals. Sometimes you're giving you treatments for infections that may also disrupt that system. Then of course the abnormalities will form. So for the men and the women, their reproductive systems are a bit different. So I'll try and give a bit of maybe clarity. The woman is born with her eggs. So right from the time she's in the uterus, as a fetus, already she has her ovaries. So the ovary is like a store of eggs, like a warehouse full of cement. So by the time you reach birth, you have about 500,000 eggs at birth. By the time you reach adolescence, it's almost half that number because you keep losing. It's like clearing a warehouse. Now, for the men, for us, the testis is like a factory. We keep producing eggs, possibly until we die. However, because of also wear and tear of the factory machine of the testis, of course, at some point, you'll find that a lot of our sperm is also defective because the machine that is working all the time eventually will begin making defective processes or defective products. So the woman is born with her eggs, and we must ensure that we maintain them in good health. So at the end of your reproductive lifespan, what we call menopause, it just means that your ovaries are no longer producing the eggs because the store is empty.
Okay, and talking about, you know, it's very fascinating that a child is being formed, but they are formed ready to form another child right at the time they're formed. So let's talk about inheriting trauma. Is that something that is scientifically proven, that while the baby is forming, they're also inheriting the mother's trauma? Or does the father play a role?
Both play a role. So if there is, for example, if there is something that is affecting your testis, that can damage my sperm. So that trauma or whatever consequences of that insult to the sperm or to the eggs will eventually cause a problem in the babies. So that it will affect the DNA. So in that way, the child will inherit the defects that are coming from the parent genetic material, and this may be shown later in life.
Do those involve psychological kinds of involvements? Say, for example, the mother is being beaten or something around the time she's pregnant?
No, that may not be the case. However, because the mother is being beaten, there may be other factors that the mother may be going through. May not have proper nutrition, she may not be going to the healthcare centers for treatment, and of course that may also affect the growth of her pregnancy, but also may expose her to certain diseases that will affect the baby growing within her, and in that way, that may manifest in the baby later in life, and maybe with poor growth, but also poor reproductive outcome for the child later in life.
So doctor, why is preconception care very important, especially in a country where statistics are showing that about 40% of pregnancies are unplanned?
So let me start just briefly by describing the types of pregnancies. So not all pregnancies are wanted. So we have what we call a planned pregnancy, and if it is planned, likely it is wanted by the patient, the parent, and it will likely be kept. Then we have planned pregnancies. People accepted to conceive, but at some point it becomes unwanted because social problems have set in, and that may also affect the outcome of that pregnancy. Then we have what we call unplanned pregnancies, but for some reason, either religious or moral, the woman or the couple decides to keep it. So we call them unplanned but wanted.
Okay.
Then there is unplanned, unwanted, and most of those will end in abortion. So preconception care over the years, with improvements in science and with improvement in the diagnosis, we understand that if before the conditions before conception are not right, that child is likely going to suffer the rest of their lives. And this will affect their outcomes, whether at work, in school, reproducing themselves, and a few other things. Now, historically speaking, women who do not attend or do not seek proper preconception care, even traditionally, women who wanted to conceive, normally at home they would give them less work. They would put them on a balanced diet. They'd be the ones to eat the eggs and things like that to improve the outcomes later. Now, with improvements in science, of course, now we can isolate the different minerals and vitamins that affect the outcomes of the baby. For example, like iron, folic acid, which affects DNA, genetic material quality. Now we can actually give them that. So if you don't have preconception care, likely the quality of your egg or the quality of your sperm will not be the best, and that will cause a poor quality fetus and the baby.
What are some basic checks that a woman should undergo, as well as the man? I would love to involve them in this. Should undergo when they're planning to have a baby, and how long before should they adjust their lifestyle?
So basically, it's no longer an issue of how long before. I think from the time you are let me give an example of a young man. Those of us who used to do contact sports, rugby, basketball, sometimes you get hit in the testes and things, and that may affect your reproductive life. People are taking alcohol, smoking, using drugs of recreation, cocaine, heroin. Those all affect the quality of your sperm. So even young men should begin right from early age to avoid abusing drugs, to sometimes also protect their genitalia to avoid problems. For the women also, for the young girls also. Of course, before they become adolescents, they also almost doing things the men would do that would affect their fertility and quality of their eggs. The main thing here is the quality of the egg and the quality of your uterus. So the uterus is one which carries the pregnancy. It's the womb and the container that carries, and it must be in a very good condition. Otherwise, even if you may be conceiving well, but you cannot carry the pregnancies because the environment inside there, from STIs, from use of chemicals like douching, may affect the quality of the inside of the uterus and cause abnormalities either in conception, miscarriages, or even infertility outright. So starting should be as soon as you are born, really. As soon as you're born, the underwear you wear, the environment that you're in, the kind of contact you're having, maybe contact sports also protect, like the cricketers put something there for the men to protect injury. But of course, footballers, rugby players, the trauma they face may actually impact their reproduction.
And so talk about the checks as well. So in the first weeks towards conception, or let's say we have like a few months and we are planning to have a baby, or we just got married or something like that, what are some checks a woman should undergo as well as a man? So
generally for the checks, we want to know if you're iron deficient or folic acid deficient. Those are the main minerals and vitamins that will improve the quality of your reproduction. So normally we want to do a blood count to look at your levels of red blood cells and to see if your iron levels are okay. And then we begin supplementing you. It is recommended that we supplement you with folic acid and iron at least 3 months before you plan to conceive, so that you have enough stores for yourself, but also improve the quality. Now, the good thing in Uganda, most of our foods now, processed foods are now fortified with those minerals because of that reason. Number two, you'd want to look out for the STIs. Syphilis especially. Of course, it's reducing but it's also still an important issue because syphilis also affects the quality of the conception. So you must check for syphilis, you must check for HIV, you must check for hepatitis B, and of course others like gonorrhea and chlamydia, which are fairly common in young people because of the sexual activity. These may also affect your reproductive life. Then of course the other issues, basic things like your weight, obesity. If you're obese, that will also affect the quality of conception. But also if you're too thin, anorexic and very, very thin, you're very low BMI, that may also affect your reproduction. And so those are the basic things. Then of course, as a couple, please don't forget to do a sickle cell test as a couple.
I was actually waiting for that.
Because those disorders are transmissible to the babies. So if you know, then you may consider maybe either getting a new partner or having advice from genetic counselors on how you can prevent conceptions that have sickle cell.
How far does the blood type go for both people?
So blood type may not affect conception, but blood type may affect the outcome of pregnancy.
Yeah.
So normally you'll hear people saying I am blood group O, A, B, and then of course they normally add the second thing there, O plus, O minus, O negative. So blood type per se may not affect conception, process of conceiving, but if you become pregnant, for example, and you're O negative, what we call rhesus D negative, and your partner is rhesus positive, sometimes during the pregnancy, the body of the woman, because it is negative, it will read the positive part of the baby as a disorder, a disease. Then it will mount an immune system that may target the conception, and eventually sometimes you may have a miscarriage, or sometimes if the baby is born, they may tend to get things like jaundice and yellowing of the eyes and things like that. Or sometimes they may die inside the uterus. So the blood type would not be something that would refuse you from conceiving, but would advise you on what to do when you become pregnant to avoid risks of losing your baby.
We have seen cases of anemia amongst pregnant women, or at birth especially. How does that affect what causes anemia to begin with?
So anemia means, so we have blood, that red thing you see when we cut, that's your blood. The red component, the red is iron. So we need the mineral called iron to deliver oxygen to all parts of the body. So every cell in the body will use iron. And of course, when you conceive, the baby's cells are multiplying very, very fast every single day to form the baby, from just one cell to billions of cells. Now, for them to actually multiply and grow, they require oxygen delivered by iron. So if they don't have iron, if the mother is iron deficient, of course, even the processes that the baby will try and consume some of it, but because of the lack of iron, the cell growth will not be as efficient as somebody who has no iron deficiency. So those babies will tend to be very tiny and very miserable or small for age. And sometimes those babies may require admission to the newborn units after delivery because of the problems with their weight and problems with controlling other things like disease.
Okay, so let's look at some diseases, pre-existing diseases like HIV, hypertension, diabetes, stuff like that. How do those conditions affect the overall preparation for pregnancy? So
we have preconception, then we have prenatal care.
Okay.
So when you come to the health facility when you're pregnant, what we normally call antenatal care here, really. The time from conception till the time you deliver. That's antenatal or prenatal care. It has about 5 purposes. Number one, we want to screen you for diseases that will affect the outcome of your pregnancy. So if you become pregnant, for example, and you are diabetic, women who are diabetic, it is known that their outcomes for pregnancy are poorer. Babies tend to die and things like that. If you're hypertensive, high blood pressure, before the pregnancy, it will tend to affect the quality of your eggs, the quality of the baby's growth, and of course, the outcomes are poorer. That's one set of diseases, pre-existing. Another set of pre-existing diseases. The first set of diseases makes the outcome of pregnancy worse. Either you lose the baby for some reason. The second set of disorders are the ones which are existing before the pregnancy, but if you become pregnant, those diseases become worse.
Oh my God.
And will likely kill the mother. For example, if you are a sickler, the burden of carrying the pregnancy will worsen your sickle cell. And most of those women will die within 2 years after a delivery. If you have heart disease, that will tend to kill you faster because of the pregnancy. If you have chronic kidney disease and you become pregnant, that will tend to kill you earlier. So generally, we may screen for them at the time before you conceive. And if they are there, we try to control them so that we improve the outcomes of your conception, but also the outcomes of the pregnancy generally.
We have a lot of young people preparing to get pregnant or who actually just get pregnant without actually noticing. And before that, their lifestyle has not been adjusted, has not been changed. What can be done in such a case in order you find out you're pregnant? What are some steps you can take in order to rescue the baby? So far, what's been damaged?
So most pregnancies, by nature, there are mechanisms which the body uses to prevent damage to the fetus.
Okay.
So naturally, I'll start with the natural mechanisms, which have been all through humanity. One of the most common mechanisms that the body will use when you become pregnant is nausea and vomiting. So the nausea and vomiting is not a bad thing per se. It is a protective mechanism to prevent you from taking in potentially harmful substances or poisons that will affect the baby.
Okay.
So in those first 9-12 weeks, when you're having the nausea, it's a good thing for us to know you have the nausea because we now know that the baby is moving well, and at some point it will stop. So when the baby's organs are fully formed, then the nausea will cease. So naturally, there are some mechanisms that are meant to protect the baby. But if you know you're pregnant, of course, if your lifestyle stop things like smoking, stop alcohol, if you're on any drugs, whether prescribed medically or for recreation, visit your health worker and see if they are safe in pregnancy. But most times nature will sort it out to avoid the abnormalities.
Okay.
But don't continue with the other behaviors because you feel you've been doing them anyway. Yeah.
There is something I just want to ask you that is that I find very intriguing. I have seen cases where if a woman is not pregnant, but they breastfeed a baby, someone else's baby, the milk will form there and then. What causes that?
So anybody can breastfeed a child, given the right conditions. So if somebody, for women, even young women who use because the breasts are now objects of sexual pleasure, the men will suck the breasts. So when you suck the breast, the brain starts to produce, thinks you're breastfeeding. So it will produce the breast milk hormone, which is called prolactin.
Oh. And
of course, you will start to express milk. So it's possible for you to breastfeed somebody else's baby if you're primed for that, whether naturally or with medication. So that's not a surprise that somebody who is not pregnant can breastfeed somebody else's baby. So it is possible.
I actually find it handy because we have mothers dying at birth. Why not hand over the baby to someone to breastfeed, you know?
Of course, there are lots of ethical issues there. And now I think like in Zambia, for example, to solve those ethical issues, we have developed a breast milk bank.
Okay.
Where
nice.
Mothers who are breastfeeding and have excess then donate to the bank, just like we donate blood. And those babies who require that milk, both in the hospital but also in the communities, are able to access that breast milk from. But the breast milk is processed. Make sure there is no HIV, no transmissible diseases. Then it is given out to these women in the communities to actually breastfeed their babies.
Doctor, there is a lot of emphasis on folic acid. Could you please talk to us again about it? I know you mentioned it among the requirements, but folic acid, how important is it, and why is it that the lack of it really causes such tragedy in pregnancies?
So folic acid is a vitamin that is essential for cell growth. When I say cell growth, particularly your genetic material, for it to multiply well with the best quality, folic acid is the vitamin which, what do you say, vital. It is vital for you to have folic acid because it takes part in the processes that shapes that DNA to get the best quality. Okay. So if you don't have folic acid, then of course the processes around dividing your genetic material become faulty. So that's why and also right from the eggs, your eggs as a woman or your sperm as a male, but also even after conception, the folic acid, as the baby is dividing its cells, it will require that vitamin. That's why you'll find us when you're pregnant, we supplement you right before you conceive to even the time after you have delivered, because the child is still growing, but also your eggs as a woman also require the folic acid to bring out the best genetic material.
Okay, thanks for that clarification. Yeah. So we are going to take a commercial break. When we return, we shall be starting off with the kinds of food you should eat before conceiving, but also at the time of conception and a few weeks after. What should you focus on? What should you avoid? That's where we shall begin. Otherwise, we're talking about preconception as well as conception here on NTV Medical Matters. We return shortly. Welcome back from that break. It's NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation. My name is Viola Kusasira, and today we are talking about preconception as well as conception. What should you know before you plan a pregnancy, but also on the onset of the pregnancy? What should you do in order to safeguard your baby as well as yourself as a mother, but also the fathers? What's your role in this, and what should you know? So today we've been joined by Dr. Othniel Musana, consultant gynecologist at St. Francis Nsambia Hospital. My name is Viola Kusasira, and we continue our conversation. Before we broke off, we're speaking about some of the supplements that you need in order to have a healthy pregnancy, but also before you conceive, in order to lay a healthy foundation for the pregnancy. So, Dr. Musana, before we went off, we're going to talk about the food. What food should any person planning to get pregnant or pregnant focus on eating, and what should they avoid in their meals?
So generally, we recommend foods that are rich in folic acid, or folate in many terms. But let me first give a bit of background why folic acid. So in the past, we used to have many babies internationally, worldwide, with what we call neurotube defects. Yes. Babies with like spina bifida and defects like that, yeah. Or with the issues to do with their nervous system. And it was found to be because of lack of folic acid. So internationally, we began to supplement foods. So you'll find your posho, whatever you buy it from, is actually supplemented with folic acid. So as you eat posho, maybe as you eat from the shop you're buying some processed foods, they put in some folic acid there so that we can prevent those defects within the babies. But generally, folic acid is found in the vegetables and also the legumes. Legumes, beans, kao, dodo, the vegetables. So those normal things you find in the home will have good amounts of folic acid. That said, the folic acid in those, it's called folate in those things, is not easily absorbed by the human intestines. So you need basically larger quantities of it to get a required dose. So supplementation forms a good role, but don't go and break the bank and say I want to buy meat, I want to buy fish. The legumes and the vegetables have the folic acid, but also your normal kaunga you buy from the market or from the shop will have supplementation. Your cooking oil has some folic acid. Your Blue Band, if you can afford, also has some folic acid in there. But if you're talking about foods, yeah, organic foods, then of course you'll have to go for the vegetables and the legumes.
When you say that, for example, the cooking oil has folic acid in there somewhere, does that mean that it's safe to actually eat fast food, if that's your preference?
So it's very difficult to dictate a diet for a woman, because if you tell her stop eating fast food, that's her lifestyle, stop eating fast food, she may not eat that day. So depending on your lifestyle, of course we'll advise you maybe reduce, but we cannot tell you to stop totally. So but of course taking a lot of fast foods, they're easily absorbed by the body, so you may tend to get obese, and that brings a new problem. So generally we'd say try and eat more organically prepared foods so that you reduce issues like obesity, but also issues like diabetes that may happen during pregnancy.
How can a mother or a young preparing mother track fertility, or if their husband or partner is focused on supporting them, how can they track their fertility without, something really affordable and simple methods? What are those?
Affordable. So generally, what has failed, I think, in the country has been the decline of teaching people what we call the fertility awareness-based methods, what we used to normally call natural family planning. Because the same method we use for natural family planning is the same methods we also use to guide couples on when they can actually conceive. So both ways, it works both ways.
Yeah.
So, but generally there is a time in the cycle whereby a woman can know that she's fertile. The other cheaper way to find out is to use what we call the moon beads. We have a thing which looks like a rosary, and somebody can track when they are fertile and know that around this time I'm able to conceive. So the moon beads have sort of fallen out of practice because of newer contraception, but there's a very big chunk of women who are seeking to conceive, and those methods are the best for them to learn the fertility awareness-based methods.
Okay.
Yeah.
And for the women that are not able to conceive, even when you may say that at a certain time in the cycle you may be fertile, what is the problem with them? But also for those who cannot carry babies long term, what is happening in their bodies?
So for the first part of those who may not be able to conceive, so for us we think there is a problem when you tell us, when you have been with your partner for at least 1 year, as a couple, and you're having sex at least twice a week. At least twice a week.
Yeah.
So when you come for assessment, we shall ask you about your sexual history and things like that. So if you have been with, some people have maybe 10 years together, but they just see each other once in a while, there may actually be no problem.
Okay.
So we first take a history to see if actually you will benefit from investigation. But generally, by nature and by evolution, human beings do not conceive as well as other animals, because we're on the top of the food chain. If we reproduce so fast, we shall consume all our food. That's from the biological point of view.
Okay.
So there are so many barriers in a woman's body to prevent her from conceiving each time she has sex.
Okay.
However, that said, if you fail to conceive for at least a year, then we shall investigate. We shall check if you're ovulating, and those we can do some lab tests, a few hormone tests. We shall check your breast milk hormone to see if it is high, because if your breast milk hormone is high, it will affect your ovulation. We shall want to see if the passage for the sperm and the egg is actually patent or is actually okay. So we normally do a small X-ray called the salping HSG to check if your tubes and other structures are okay. And if the tubes and structures are okay, most times you will conceive naturally, most times, if they are okay. But also lately, we have found that most of our women coming in with, young women with complaints of being unable to conceive are having a disorder called endometriosis.
Yeah.
Previously we used to call it PID, we think you have an STI, I think you're promiscuous, but endometriosis, because it may damage the environment in the tubes, it may damage the eggs in the ovary, but also may damage the uterus itself, making it hostile for both sperm and the egg to actually implant there. So women who are coming in with this sort of having painful periods all the time, then we may intervene to try and see and help them conceive. So don't ignore painful periods. Seek some advice from your gynecologist and an assessment. Even if you plan to conceive 10 years later, at least have an assessment to make sure that things are okay in there. The second category are the women who fail to carry their pregnancies to the 9 months. Either they are miscarrying within the first 3 months, or within between 4 to 6 months, or they are losing their babies.
Yeah.
For the women who are miscarrying before 3 months, repeated, we call them recurrent miscarriages. For that group of women, normally either there is a problem with their ovaries, producing enough hormones to support the early pregnancy, and if you go to your gynecologist, they will assess you and manage you for that. Sometimes they have disorders of the immunity. Remember, sperm is not part of the woman's body.
Yeah.
So the immune system in pregnancy has to crash to avoid attacking the genes of the man, because they're not part of. So that's why your immune system may be lower in pregnancy. So if your immune system is attacking that part which doesn't belong to it, of course the pregnancies will tend to miscarry. Then of course the other third aspect is that for some of the women who are miscarrying, the uterus may have abnormalities, by structural abnormalities. Either the container can't hold and expand, and those can be dealt with and investigated well. Then of course, then the last part is now, as for example, for us men, even women, into your 30s, into your 40s, the quality of your eggs is not good. So you may have consumed your best eggs in your 20s. So in your late 30s, the eggs are not good quality. So of course, if you conceive, the genes are not the best. So the body will just expel them. So that's the first 3 months. Between 4 and 6 months, if you survive the first 3 months, now it becomes an issue. Can the container, which is the uterus or the womb, hold up the pregnancy? So some category of women, you'll find that they have a weak cervix that cannot contain the weight of the pregnancy. And those women will tend to miscarry between 4 to 6 months, what we call an incompetent cervix.
Okay.
Yeah, so that's also fairly common. And it may be worsened by heavy work that women do in the communities, because they're lifting heavy load. After that, after 6 months, then of course the other issues to do with infections and that may cause preterm labor. But most of those conditions are treatable. The issue is that you must seek to get to see at least the obstetrician or the gynecologist to assess you well. And we have cheap methods or affordable methods to actually manage most of those disorders.
I was actually going to follow up with that. What are some of the alternatives that are there? Because for someone watching and they've tried several times to have a child, they've been told they're barren. I know that back then they would just say you're barren, so they just cast you out. But right now, I believe science has really advanced. So what are some of the methods that someone can use on the side when they've tried over and over with their partner and they don't get a child?
So I think the biggest problem for most women is getting an answer.
Yes.
Is getting, why am I miscarrying all the time? And that can be frustrating for both the woman but also the families.
Or why can't I get a child? Why can't I get a... Because I know there is trade of blame in between the people, and most likely it may fall on the woman. So
now, right now, there is a good number of gynecologists all over the country that can diagnose and help these women. So at least I'm sure now the Ministry of Health, in every hospital, there are gynecologists there. And those gynecologists are put there to look at what we call the high-risk women, from fertility issues, preconception issues, to pregnancy complications. Yes. Those gynecologists are there. And now they can deal with the problems of fertility, but also the problems of losing the pregnancies. So please go to your hospital. If you don't know, just type in gynecologist on Mr. Google, sir. It will give you a name and we can direct you there.
I was looking at options like IVF. Where do those come in? And how accessible, how easy, how reliable are they for our viewers?
So before you get to IVF, there must be a reason as to why things have failed. So IVF is at the extreme. So IVF is part of what we call the assisted reproductive technology. Assisted. And the variety of reasons why people may choose or they may have a recommendation to have an IVF. So for those who want IVF, let me start from there. The government has built a very big facility here at Mulago, specialized hospital here, that is now offering IVF, so you can visit there. But there are also multiple centers within Kampala and the regions which are now offering IVF services. Now, IVF means we harvest a woman's eggs, and we harvest the man's sperm, and then fertilize them outside the body. Then after maybe between 3 to 7 days later, we shall then implant, put into your uterus, and see how things go. So IVF is not the answer, but it's part of the answer. And it's about 40 to 50% effective. Not all pregnancies that IVF woman will conceive, but at least it has improved a lot. So for you to require IVF, one, either your tubes are blocked, so it means your egg and the sperm cannot meet. So we shall offer you the IVF. In some cases, for some women, maybe the ones who are menopausal, those who no longer have their eggs, we shall get eggs from a donor woman, and they'll choose the sperm of choice.
So we have a... Yes, please, we can hear you. What's your name and what's your question?
This is Fred.
Okay.
I had the complication with my wife during pregnancy.
Okay.
Then after delivery, the complication was high blood pressure. And she developed some skin reaction. She started scratching herself for itchy skin. We have tried all our medications, but it's not helping us.
All right, thank you. Thank you. The doctor will answer your question. Thank you so much. And so our phone lines are open, our viewers, so you can now call in and you can ask any question you would want a doctor to answer. And you can also ask in Luganda if you wish. And doctor, some of the things we shall have to tell our viewers in Luganda to make sure the point gets home. Those are things like folic acid and any other thing that is very, very important when it comes to pregnancy. But if there is any other caller, we shall be getting you. I wanted to get about 3 questions.
Hello.
Yes, please, I can hear you. What's your question? What's your name?
Good morning, madam. This is Sarah.
Okay.
I would like to ask the doctor, why is it I'm around 30 weeks pregnant?
Yes.
I've been given faithful, but every night I take it, I feel more hungry at night.
Okay.
And another question, I've had 2 C-sections.
Yes.
Now I'm carrying the 3rd baby. I don't know at how many weeks. They say 37, 38. I don't know at how many weeks will I be able to get an appointment to the hospital.
Okay, thank you so much, Sarah, for your question. If there is someone else coming through, you can also call through. Let's get a couple of questions and then we shall do them all at once. But so people, you can call our numbers on your screen. You'll be able to get to the doctor directly so that he can answer all your questions. We're talking about preconception, conception, any questions surrounding that. Make sure that you call in. And also on social media. Yes, please. Hello? I can hear you. What's your question?
Hello?
Yes, what's your question?
Ono Jennifer Kubene Kayunga.
Okay.
Badde ngamba doctor oyo.
Oh, sorry. We lost Jennifer. We didn't get to hear her question. But for any other questions, make sure you go to our social media. We're also streaming live on X as well as our website. I can hear someone coming through.
Hello.
Yes, please. What's your name and what's your question?
My name is Namka.
Okay. What's your question?
I wanted to ask the doctor, can I get pregnant? Can I do exercise when I'm pregnant? Yes, I have gone under C-section before giving that before. Can I do exercise when I'm pregnant? Yes, I have gone under C-section.
Okay. Okay, so that question sort of faded away, but we shall take these calls for one of these questions. We first get through them, and then we shall get back to you in case you have any other questions. So, Doctor, we start with the first gentleman.
So for the first gentleman who asked, his wife had a high blood pressure, which is a common complication of pregnancy, normally called preeclampsia, and it's among the most important reasons as to why we do antenatal care, because pregnancy by itself will cause complications, and the most dangerous one is preeclampsia, high blood pressure that happens during pregnancy. Now that high blood pressure, if not resolved or if not managed well, will damage a lot of organs, from the liver to the eyes to the brain to the kidneys, and of course those organs have other functions. And some of the symptoms that she may be presenting with, like the itchiness and other things, may be more to do with the organ damage. However, it's very important that she goes and sees her gynecologist, and they see if these are related to the high blood pressure that she got during pregnancy. So preeclampsia is a killer, and the single most important thing as to why you must attend antenatal care is to check your blood pressure. Never leave without getting your blood pressure checked. Let them at least forget to check the baby, because you can say baby is kicking, but the pressure, it kills. So we must know the pressure. So for him, I would advise that he goes to the gynecologist, they do an assessment of all her organs that may be affected by the preeclampsia, and then they may give them an answer much better. The second lady, the other one asked about exercise during pregnancy. We do not refuse you from doing exercise during pregnancy. What we normally would advise you is to avoid heavy lifting. Because if you're lifting heavy weights, like for example squatting and lifting something up, you're putting pressure on the uterus and pushing downwards. It's almost like although you're defecating. So that pressure may sometimes cause complications. It may either break your waters, or it may even cause labor in some cases, premature labor. So we tell you to avoid those extreme lifting. But exercising is okay, and there are different sets of exercises we recommend for pregnant women. But also they will help in what we normally call pelvic girdle pain, because pregnant women tend to have problems with the pelvis because the muscles have become loose and unstable, so they will feel it as pain. So exercise will tend to relieve some of those issues. Just about, think about C-section. She's about 30 weeks. When does she get an appointment?
38, something like 38 weeks or 37.
So
and she wants
if you come to the hospital and there is no immediate risk to the mother and the baby, we will normally recommend you do a C-section at 39 weeks.
Okay.
Because there we are sure about the age of the baby and the baby's term. We try to prevent delivery by delivering preterm babies. But also from our research worldwide, the best time to deliver is at 39 weeks, but sometimes may be brought forward to about 38 weeks if maybe we think you may go into labor and have other issues, or if your history has been a bad one, we may sometimes bring it forward to about 38 weeks. 37 weeks is a bit stretched because you may still be preterm. So 39 weeks is the optimum time, at least that we agree as gynecologists internationally, for delivery at cesarean section. The other question for the other person was about what?
There were three questions. Those were the three questions.
But
maybe what you can do is give out your contact,
yes,
so that they are able, the one you want to share with them, so that they're able to reach you. There was that woman who wants to consult. So
please, if you want to consult, my number is public, but also the gynecologists in Uganda have the association with a call center where we can link you to any gynecologist in the country, but also answer some of your questions. It is called the AOGU website, and it has a call center. I can't recall the number, but it has a call center. People call in and are offered advice on pregnancy, miscarriages, and things like that, but also linking them to the right people. Because we know a lot of our women are not getting the right people. So they tend to come to us with complications to do with pregnancy or other gynecological disorders that may happen. Yeah.
Okay, so talking about the time of delivery, what causes a stillborn?
So there are two types of stillborn. So stillbirth just means the baby died before delivery. It may happen during the time of labor, and of course we'll have what we call a fresh stillbirth or a fresh stillborn. So if you're in labor and your baby you came when the baby was alive, but during the process of monitoring labor, the baby dies. Usually such babies have had an accident during the time of labor. Either there is a cord problem, or there was a problem of monitoring and failure to detect that the baby was having problems. Then we have those who have died more than 24 hours before delivery, what we call macerated stillbirths. So those ones normally point to the quality of the care you have received during antenatal. So one is the quality of care during antenatal, and we fail to detect that this woman is either high risk or this baby is at risk of dying. But the other one, which is fresh, so the other type, which is born, for antenatal, what we call the MSB, normally come with skin which is peeling off. And those ones have died at least 24 hours before. So those ones, normally it is a problem on our side in detecting that there may be a problem with this woman. So women who may be having problems with women will tell you sometimes, my baby is not moving the way it has been moving before. Okay? Or if they have a fever and you not tell them when you have a fever, please come to the hospital, they may delay. So the lack of understanding of danger signs from education during antenatal may be what puts them at risk of getting the stillborns. But in labor, I have come, I've reached 9 months, and I've come and I'm in labor. Usually it's a problem of the health workers failing to monitor adequately, either because of they're overwhelmed with numbers, or they may miss something along the way during the monitoring of labor that may cause the baby to lose oxygen for some reason and then of course die.
Okay, so there is time for just one call in case it comes through, but as we wind up, Doctor, let's talk about when a woman is able to carry the baby for all that time, but then sometimes they have babies that they carry full term, other times they cannot carry a baby full term. What is the difference and why is it happening on one same person?
In the same person. So usually there is a reason. So when I say term is the 9 months, at least 36 weeks and above. Preterm is below that. So usually women who have preterm births, usually there is a reason. Either their water breaks because of an infection around the cervix that will affect their sac, amniotic sac, or there is maybe trauma, or sometimes there is a defect. There's a defect with the baby and the body is saying, let us remove this baby. Or sometimes they may have had a history. Either maybe their work is heavy and things are happening, and of course labor will get in there. So that's one case. Then the other one, of course, there are other disorders which may also affect. For example, the complications of high blood pressure. A good number of the babies are born preterm.
I've actually seen a woman I've seen multiple women that give birth and they end up having like a blood clot or something of that nature. Well, what causes that? So
usually the most common complication is the high blood pressure, preeclampsia.
Okay.
And if it is there and we find that it's destroying your organs, we have to deliver the baby to save you. So sometimes you find the woman told her she may feel okay, but there are problems with her organs. We tell her, please let us deliver this baby to save you and your organs. So we may deliver them preterm for that reason.
Okay, so this is the time we had this is a conversation we're able to have within a designated time. So I'll give you like 1 minute to say your last words to our viewers, but also to debunk anything that you've had surrounding preconception and conception as we get out.
So preconception is not an issue you solve in adulthood. It begins right from the time you are a fetus. Now there are theories which are pointing to beauty products also causing problems in the fetuses. So of course now in Africa women are using a lot of hair creams which contain a lot of hormones. Women are using a lot of skin creams which contain a lot of hormones. So a lot of those things may affect the health of the baby, and of course when these children grow later in life, then they will come with gynecological problems that may affect conception and pregnancy. So don't think about it as the problems began now. Sometimes it may precede right from the time you are a fetus by you then. Then number two, I think the culture should improve in Uganda. In Uganda, most of the care has been focused around the mother and the baby, and not focused a lot on preconception care in the communities. So I think the Ministry of Health needs to design a program whereby maybe they have a clinic in the hospitals just to take care of women who just want to conceive.
Yeah.
Because if you come and you're not pregnant in a facility, most times we don't have that time for you. Yet actually, that's the best time to begin to prevent problems that have to do with pregnancy and fertility.
Okay, we've run out of our time, but thank you very much for your time this morning, and thank you for this very wonderful information about preconception and conception. So I hope, our dear viewers, you were able to pick up something from what the doctor was discussing here about preparing for pregnancy, but also pregnancy and just general lifestyle. So that brings us to the end of today's conversation about preconception and conception. I'm Viola Xasia. You've been watching NTV Medical Matters, and we are supported by Bill and Melinda Gates Foundation. I wish you a wonderful week.